There is a question that many men never say out loud but carry with them quietly. It shows up in internet searches late at night, in private worries they keep from their partners, and in the subtle anxiety that lingers when they read headlines about men's health. The question is simple, but the weight it carries is not. What really happens to the prostate if a man masturbates every single day? For decades, answers to this question have been clouded by myths, stigma, and fear. Men have been told that too much sexual activity will damage the body, that the prostate can be worn out, that frequent release may lead to chronic inflammation or even cancer. The fear of prostate cancer in particular casts a long shadow because it is one of the most common cancers that men face. And so, something as ordinary as sexual release has been turned into a source of dread. Today I want to address this issue with clarity, with science, and with the perspective of someone who has spent more than 3 decades working in men's health. I'm Dr. Brian Caldwell. For over 30 years, I have treated men dealing with everything from prostate enlargement and infections to advanced prostate cancer. I have sat with patients who were frightened by the things they had read online, convinced that normal sexual activity might be harming their health. I have also seen the consequences when men ignore their prostate health, out of embarrassment or misinformation. That is why I believe it is so important to speak about this subject openly, to separate fact from fiction, and to explain what the best available science actually tells us. Because the truth is very different from the warnings many of us grew up hearing. To understand the issue, we need to start with the prostate itself. The prostate is a small gland, about the size of a walnut, that sits just below the bladder and in front of the rectum. Its primary function is to produce the fluid that mixes with sperm to form semen. That fluid is essential for fertility, but the gland's role extends beyond reproduction. Because of its position and function, the prostate can affect urination, sexual performance, and overall quality of life, in ways men quickly notice when problems arise. As men age, the prostate naturally becomes a point of concern. Enlargement, infections, inflammation, and cancer are all issues that bring it under medical scrutiny. Against this backdrop, it is not surprising that the idea of daily ejaculation raises questions. If the gland is so central to male health, could frequent use possibly harm it? The myths that circulate are persistent. Some claim that too much sexual activity can cause prostatitis, a painful inflammation of the gland. Others suggest that ejaculation increases the risk of prostate cancer, the very disease most men fear as they grow older. These ideas have been passed down through generations, often reinforced by cultural taboos around sexuality. For many years, they went unchallenged, not because evidence supported them, but because few researchers had taken the time to look closely. In the absence of data, warnings flourished, but that changed when large-scale studies began to investigate the relationship between sexual activity and prostate health. And what those studies revealed was not only surprising, but directly opposed to the old fears. One of the most important of these studies was carried out by researchers at Harvard University's T.H. Chan School of Public Health. This was not a casual survey or a short experiment. It was a rigorous, long-term project that followed nearly 32,000 men over the course of almost 2 decades. The researchers tracked a wide range of lifestyle and health factors, including how often the men ejaculated each month. When the data were analyzed, the results were striking. Far from finding that frequent ejaculation increased the risk of prostate cancer, the study showed the opposite. Men who ejaculated more frequently had a significantly lower risk of developing prostate cancer. The effect was not minor. Men who reported 21 or more ejaculations per month had up to a 33% lower risk compared to those who reported only 4 to 7. That is a substantial difference, enough to shift the conversation about masturbation and prostate health in an entirely new direction. This finding has been supported by other research, including a major Australian study that showed a similar protective effect. Taken together, the evidence makes a strong case that regular ejaculation, whether through sex with a partner or through masturbation, may play an important role in keeping the prostate healthy. The question then becomes, why? How could something as ordinary as ejaculation provide such a measurable benefit? One explanation is known as the prostate stagnation hypothesis. To understand it, picture the prostate's ducts as a network of small pipes. Over time, these ducts can accumulate fluid, cells, and potentially harmful substances. If that material remains in place for too long, it may contribute to inflammation or create an environment where cancerous changes are more likely to occur. Regular ejaculation, by this reasoning, serves as a natural cleansing process. It flushes out the ducts, clearing away the buildup and reducing the chance of long-term damage. In other words, daily release helps keep the gland's environment fresh and less prone to harmful changes. Another explanation involves cellular turnover. Every time a cell divides, there is a chance for genetic errors to occur. Some of those errors can lead to cancer. The theory here is that frequent ejaculation promotes a healthier cycle of cell renewal within the prostate. By encouraging the gland to replace older cells more regularly, it reduces the opportunity for damaged or abnormal cells to accumulate. This ongoing process may make it harder for cancerous mutations to take hold and progress. There is also a psychological and systemic dimension to consider. Ejaculation is closely linked to stress relief. We know that chronic stress contributes to inflammation throughout the body, and chronic inflammation is one of the key factors associated with cancer risk. By lowering stress and tension, regular ejaculation may help maintain a healthier immune and hormonal balance, indirectly protecting the prostate. These scientific explanations provide a strong basis for understanding why frequent ejaculation appears to be protective. However, it is important to place this knowledge in its proper context. Ejaculation alone is not a magic shield against disease. The Harvard study and others like it show a correlation, not an absolute guarantee. Men who ejaculate frequently may also engage in other healthy behaviors, such as regular exercise or better diets, which contribute to the overall lower risk. What we can say with confidence is that ejaculation does not harm the prostate and, in fact, may be one of several factors that help it remain healthy over time. When we look at the evidence more closely, it becomes clear that daily ejaculation is far from the harmful practice men have been told to fear. In fact, it appears to be a normal physiological process that may offer protection. Does this mean that if a man masturbates every day, he is guaranteed to avoid prostate cancer or never develop prostate issues? The answer is no. To put this in context, think about heart health. Exercise is known to reduce cardiovascular risk. Yet no one would suggest that exercise alone can guarantee freedom from heart disease. Genetics, diet, smoking, blood pressure, and many other factors also play a role. In the same way, frequent ejaculation may support prostate health, but it cannot replace other essential elements such as nutrition, physical activity, weight management, and medical screening. Let us return to the biological explanations for why ejaculation may matter, because understanding the mechanism makes the findings easier to accept. The stagnation hypothesis, that ejaculation clears out the ducts, resonates with many patients because it is logical. Just as the bladder benefits from regular emptying to avoid infection, the prostate may benefit from being flushed. But beyond simple clearance, ejaculation also influences local hormone levels. Prostate tissue is highly sensitive to hormones like testosterone and dihydrotestosterone. Changes in hormonal environment influence how cells grow, divide, and repair. Regular sexual activity seems to keep this environment more balanced, reducing the conditions in which abnormal growth can develop. While research in this area is ongoing, the evidence is consistent enough to give this idea credibility. The second explanation, cellular turnover, is less intuitive but equally important. Every organ in the body is made up of cells that eventually wear out and are replaced. The prostate is no exception. If old or damaged cells linger, the risk of genetic mutations increases. By stimulating renewal, frequent ejaculation may help keep the gland's cellular population healthier. Think of it as pruning a plant. Regular pruning encourages new, vigorous growth and prevents the accumulation of weak or diseased branches. Similarly, regular sexual release may encourage a more efficient replacement of prostate cells, reducing the opportunity for harmful mutations to accumulate. The third mechanism, stress and inflammation, is perhaps the most relevant to modern life. Men today live under constant pressure. Work, family responsibilities, financial concerns, and aging itself all create stress. Chronic stress leads to elevated cortisol, disrupted sleep, increased blood pressure, and a pro-inflammatory state in the body. Inflammation is a recognized driver of many diseases, including cancer. When ejaculation reduces stress, it does more than provide a moment of relaxation. It may be lowering the body's background level of inflammation, which is particularly beneficial for organs prone to disease. But we must not ignore the fact that not all prostate symptoms can be explained by cancer risk. Many men struggle with issues such as benign prostatic hyperplasia, or BPH, which is a non-cancerous enlargement of the gland. BPH can cause urinary problems, frequent nighttime urination, difficulty starting or stopping the stream, and the frustrating sense of incomplete emptying. These symptoms often begin in midlife and worsen with age. Masturbation or ejaculation may provide temporary relief for some men, but it is not a treatment for BPH itself. The gland enlarges because of hormonal and cellular changes that are only partly related to ejaculation. For this reason, it is essential that men with urinary symptoms seek medical evaluation rather than assuming that sexual activity will solve the problem. There is another point that deserves careful explanation. Some men worry that if they masturbate daily, they will damage their sexual function or wear out their ability to perform with a partner. This is a myth. Erectile function is influenced by vascular health, nerve integrity, and psychological confidence, not by frequency of release. If anything, regular sexual activity maintains function by keeping blood vessels and tissues active. In the same way that regular walking keeps the legs strong, regular erections keep penile tissue healthy. The idea of sexual exhaustion from daily activity is not supported by evidence. What is more common is that men who already have underlying issues, such as diabetes or vascular disease, notice declining function and mistakenly blame masturbation rather than the true cause. In addition, some men experience guilt or shame about masturbation because of cultural or religious teachings. That guilt can contribute to stress, anxiety, and even relationship difficulties. As a physician, I am not here to tell anyone what to believe morally. My responsibility is to present what the evidence says medically, and the evidence is clear. Masturbation is not harmful to the prostate and may in fact be beneficial. For men who are struggling with guilt, understanding the science can sometimes help relieve unnecessary fear. I often tell patients that acknowledging sexual health as a normal part of overall health is one of the most important steps they can take. Denying it, hiding it, or treating it as shameful rarely improves health outcomes. We should also consider the generational gap in knowledge. Older men grew up in a time when information about sex was scarce, often distorted, and rarely discussed openly. As a result, myths became ingrained. Younger men today have access to more accurate information, but they also face overwhelming amounts of misinformation online. Both groups benefit from hearing the truth clearly explained. Now, let me touch on an important caution. While frequent ejaculation is linked to lower risk, men should not interpret this as permission to ignore the rest of their health. Prostate cancer screening remains essential. The PSA blood test, despite its limitations, remains a valuable tool when interpreted carefully by an experienced physician. For men with a family history of prostate cancer, or those over the age of 50, regular screening is strongly recommended. Caught early, prostate cancer is often treatable with excellent outcomes. Waiting until symptoms are advanced reduces options and survival rates. Ejaculation cannot substitute for early detection. In my decades of practice, I have also observed how diet interacts with prostate health. Men who consume diets rich in vegetables, fruits, and healthy fats tend to have fewer prostate problems. Lycopene, an antioxidant found in tomatoes and watermelon, has been associated with improved prostate outcomes. Green tea and foods rich in omega-3 fatty acids, such as salmon and sardines, also appear to support prostate health. On the other hand, diets high in processed foods, red meats, and unhealthy fats are linked to worse outcomes. This is another reminder that ejaculation is only one piece of the puzzle. It works best in the context of an overall healthy lifestyle. Exercise deserves equal emphasis. Physical activity helps maintain a healthy weight, regulates hormones, and reduces inflammation. Even moderate activities such as brisk walking for 30 minutes most days can significantly lower risk factors for prostate disease. When I combine this advice with the discussion of ejaculation, patients often realize that a holistic approach gives them more control than they imagined. Instead of focusing on a single behavior, they see how all the pieces fit together: sexual health, nutrition, exercise, and medical care forming a network of protection. It is worth pointing out that research continues to evolve. While the Harvard study and others provide strong evidence, science never stops asking questions. Future studies may refine our understanding of the exact mechanisms or identify subgroups of men who benefit more or less from frequent ejaculation. That is the nature of medicine. But for now, the weight of the evidence strongly supports the conclusion that masturbation is not harmful and is likely protective. For men who have spent years worrying that they were damaging their bodies, this knowledge can be liberating. By this point, I hope it is clear that the old warnings about daily masturbation were based more on myth than on fact. The prostate is not weakened by frequent release. On the contrary, it may be strengthened by it. What truly puts the prostate at risk is ignoring its health altogether, allowing obesity, smoking, poor diet, stress, and lack of medical screening to go unchecked. Addressing these issues alongside a healthy sex life gives men the best chance of avoiding serious problems in the years ahead. One of the points I always stress is that masturbation is only one way to maintain a healthy frequency of ejaculation. Sexual activity with a partner provides the same effect from a physiological perspective. Some men worry that as they age, their ability to maintain regular sexual activity will decline, leaving them unable to gain this benefit. It is true that erectile dysfunction and decreased libido become more common with age, but these conditions are not inevitable and are often treatable. In fact, maintaining a healthy pattern of sexual activity, whether alone or with a partner, can itself help preserve function by keeping the vascular and nervous systems active. In this sense, the relationship between ejaculation and sexual health is circular. Regular activity supports function, and good function makes regular activity easier to maintain. For men experiencing difficulties, speaking openly with a physician can open doors to treatment options that improve both quality of life and overall health. It is also important to understand that while frequent ejaculation may support prostate health, it cannot erase risks tied to other factors such as genetics. If your father or brother had prostate cancer, your own risk is higher. That reality does not mean cancer is guaranteed, but it does mean vigilance is necessary. For men with a family history, prostate screening should begin earlier, sometimes as early as age 40. In these situations, ejaculation should be seen as a supportive measure, not a substitute for medical oversight. Too often, I see men delay screening out of fear of the PSA test or discomfort with the idea of a rectal examination. Yet these tools remain the most effective ways to catch prostate cancer early when treatment is most successful. The message I want to convey is that combining healthy lifestyle habits with regular medical care creates the strongest shield against disease. Now, let us address the psychological side once more, because it cannot be ignored. For many men, guilt around masturbation creates as much distress as the physical. Myths. They carry childhood warnings that it was dangerous, immoral, or shameful. And those ideas persist even into old age. What I tell patients is this: shame has no protective effect on the body. What protects the body is science-based care, and the science shows that masturbation is not harmful. Letting go of unnecessary guilt allows men to approach their health decisions with clarity rather than anxiety. The relief that comes from this understanding can itself improve quality of life, reduce stress, and even enhance relationships. When men stop fearing their own normal biology, they become better equipped to take control of their overall health. One question I am often asked is whether there can be such a thing as too much. Can daily masturbation become excessive in a way that harms health? The answer depends on context. Physiologically, the act itself does not damage the prostate, even when performed daily. The potential for harm arises only when it begins to interfere with daily functioning, relationships, or responsibilities. If a man finds that his sexual activity is compulsive, preventing him from living a balanced life, that is not a prostate issue, but a behavioral one, and it deserves attention. For the average man, however, daily masturbation is a normal, safe, and even beneficial activity. As we reach the conclusion of this discussion, I want to return to the original question with a clear and confident answer. What happens to the prostate if a man masturbates every day? Based on decades of research and my own experience in men's health, the answer is this: it does not harm the prostate. On the contrary, regular ejaculation appears to support prostate health by lowering cancer risk, promoting healthy cell function, and reducing inflammation. It should be seen not as a threat, but as a natural process that works in partnership with other healthy choices to protect one of the most important glands in the male body. It is not a cure-all, but it is certainly not the danger men were once led to believe. So, what should you do with this information? If you are a man over 40, make prostate health a priority. Do not ignore urinary symptoms, do not skip regular checkups, and do not allow fear of embarrassment to keep you from talking with your doctor. At the same time, embrace the fact that a healthy sex life, whether with a partner or through masturbation, is a normal part of staying well. Pair it with good nutrition, regular exercise, and avoidance of harmful habits like smoking, and you will give your prostate the best chance of staying healthy. These steps, simple as they may sound, add up to powerful protection over time. After more than 30 years in practice, I can tell you that the men who do best are not the ones who rely on a single habit or a single treatment. They are the ones who take a balanced approach, staying informed, taking responsibility, and being proactive rather than reactive. Daily ejaculation can be part of that approach, but so can walking, eating well, staying at a healthy weight, and seeing your physician regularly. Together, these habits create a foundation of resilience that keeps men strong well into later life. I will end with this message: do not allow myths to control your health decisions. Do not let stigma or fear prevent you from acknowledging what is natural and normal. The prostate is a small gland, but its influence on a man's health is enormous. By understanding the truth and acting on it, you can protect yourself from unnecessary worry, preserve your quality of life, and face the future with greater confidence. And that is my goal as a physician: to give men the clarity and tools they need to live not in fear, but in strength and knowledge.